Did you know measles nearly wiped out a refugee community in Minnesota, and the reason had nothing to do with poverty or access to healthcare? In 2004, Somali families in Minneapolis were vaccinating their children at a 92% rate, higher than most of the state. They had fled war, they had rebuilt lives from nothing, and they trusted the system completely. Then a man flew in from Texas. His name was Andrew Wakefield. He had been stripped of his medical license in the United Kingdom, struck off, banned, for fraud. He sat down with Somali parents and told them the vaccine that had been protecting their children was the reason those same children were struggling. He told them the pharmaceutical companies knew, that the government was hiding it, that he had the evidence. By 2014, vaccination rates in that community had collapsed to 45%. In 2017, measles tore through the Somali community, 79 cases, 65 of them were children of Somali descent, 95% unvaccinated, 31% hospitalized. A community that had arrived in America healthy and protected had been systematically taken apart. And the man who did it had designed the whole thing 20 years earlier in a British laboratory with falsified data and a 35-page business plan that projected £28 million a year in profit. This is the story of what Andrew Wakefield built, who he buried, and why he has never been charged with anything. To understand what happened, you need to understand who Andrew Wakefield was before 1998. He was not a quack. He was not operating from the fringes. He had trained at St Mary's Hospital Medical School in London. He held a fellowship with the Royal College of Surgeons. By the mid-1990s, he was a gastroenterologist at the Royal Free Hospital, one of the most prestigious teaching hospitals in Britain. He had published real research, built a real reputation. He was, by every external measure, a serious person doing serious work. His focus was the gut. Specifically, he had become interested in whether measles virus could cause inflammatory bowel disease. The evidence for that theory was thin, and most of his colleagues were unconvinced. But Wakefield was convinced, deeply convinced. In 1996, a personal injury solicitor named Richard Barr reached out to him. Barr was building a lawsuit against the manufacturers of the MMR vaccine, the combined measles, mumps and rubella jab introduced in the UK in 1988. He needed a doctor who could build a scientific case linking MMR to bowel disease and autism. He found his man. What happened next was not an accident. It was not a mistake. It was a transaction. Barr's firm began funneling money to Wakefield through the UK Legal Aid Board. The rate was £150 an hour. Over the course of the arrangement, the payments reached £435,643, plus expenses. Not disclosed to the Lancet. Not disclosed to Wakefield's own institution. Not disclosed to anyone. That money was already flowing 2 full years before Wakefield published a single word. On the 28th of February 1998, the Lancet published a paper co-authored by Wakefield and 12 other researchers at the Royal Free. The title was long and clinical. The contents were, by scientific standards, extremely modest. 12 children, no control group, no randomization. A case series, which in medicine is roughly the equivalent of saying, here are some patients we found interesting. The paper itself was careful. Wakefield wrote in it that the study did not prove an association between MMR vaccine and the syndrome described. But then came the press conference. On the same day the Lancet paper was published, the Royal Free Hospital held a video news release for journalists. Wakefield stood in front of cameras and told them he could no longer support the continued use of the triple MMR vaccine. He said parents should request single doses of measles, mumps and rubella given separately. The BBC ran it that evening. Every major newspaper in Britain ran it within 48 hours. And most of them did not read the actual paper. They listened to the press conference. They heard Doctor and Lancet and MMR and autism and ran with it. UK MMR vaccination rates had been sitting at around 91%. They fell. Year on year they fell. By 2003, coverage in 2-year-olds had dropped to 78.9% nationally. In parts of inner London, the rate was close to 50%. Herd immunity for measles requires 95% coverage. Below 80%, outbreaks are almost mathematically guaranteed. Wakefield had just handed measles the opening it needed. But what nobody outside a small circle of people knew yet was why he had done it. And when that answer came out, it was worse than anything the press had reported. In March 1995, a year before Barr hired him, Wakefield had filed a patent. The patent covered a method of diagnosing inflammatory bowel disease using measles virus found in gut tissue. In June 1997, he filed a second patent. This one covered a safer single measles vaccine, a replacement for MMR with treatments attached. He owned the patent on the alternative product, the product that parents would turn to if MMR was destroyed. And it goes further than that. Brian Deere obtained a 35-page business prospectus for a company called Carmel Healthcare, named after Wakefield's wife, which Wakefield planned to register in Ireland. The document was explicit about how the company would make money. It projected income rising to £28 million a year. £28 million annually. The revenue model did not depend on MMR being unsafe. It depended on the public believing MMR was unsafe. The prospectus used the phrase litigation-driven testing. It stated that once Wakefield published, public and political pressure would make demand for a diagnostic enormous. University College London reviewed that document in December 1999. They told Wakefield his plan appeared to depend on premature, scientifically unjustified publication of results. He was asked to leave the Royal Free by mutual agreement in 2001. By then, the damage was done. A journalist named Brian Deere started pulling on this thread in 2003. What he found, through years of investigation and a 217-day General Medical Council hearing, was that the paper had not just been funded dishonestly, the data inside it had been changed. The study reported that 9 of the 12 children had regressive autism. Deere found that only 1 child clearly had regressive autism. 3 had no autism diagnosis of any kind. 5 had documented developmental concerns that existed before their MMR vaccination, so the paper had described them as previously normal, when their own medical records said otherwise. The bowel findings had been altered too. 9 of the 12 children were reported to have non-specific colitis, meaning bowel inflammation. The original biopsy reports, written by the actual pathologists who had examined the tissue, had recorded the results as normal or unremarkable. Someone went back in and upgraded them. And the timelines. The paper implied that behavioural symptoms appeared within 14 days of the MMR injection. Deere found that for several children, the symptoms had appeared months later. For at least 1 child, the problems had started before the vaccine was given at all. Onset dates had been changed to make the story fit. The British Medical Journal published Dear's full findings in January 2011. The editorial that accompanied the series did not call it flawed research. It did not call it poor methodology. It called it, in print, an elaborate fraud. The Lancet fully retracted the paper on 7 February 2010. The General Medical Council struck Andrew Wakefield off the UK Medical Register in May 2010 after a hearing that lasted 217 days and found dishonesty across 4 separate counts. But being struck off did not stop him. It didn't even slow him down. Because by 2010 he had already moved to a country where his reputation was still intact. And he had found a new audience, one that was, in many ways, even more vulnerable than the first. Somali refugees began arriving in Minnesota in significant numbers through the 1990s and early 2000s. They came from one of the most conflict-devastated countries on Earth. They arrived in a state with good public health infrastructure, and they used it. By 2004, Somali 2-year-olds in Minnesota had a 92% MMR vaccination rate, among the highest in the state. Around 2008, something shifted. Parents started noticing that Somali children seemed to be disproportionately enrolled in autism special education programs. A 2013 University of Minnesota study found an autism prevalence in Somali children of roughly 1 in 32. The fear inside the community was real, and the community had no prior cultural framework for autism. In the languages most families spoke at home, there was no word for it. Wakefield arrived. Minnesota Department of Health officials later confirmed he made at least 2 documented visits, starting around 2010. He sat with families. He told them what he had been telling the world since 1998. MDH spokesperson Kate Awesome said publicly, "Andrew Wakefield is the prime example. He significantly contributed to what's happened in Minnesota. He met with them." Coverage dropped roughly 5 to 7% every year. By 2014, it had fallen to 45%. In 2017, measles moved through the community. 79 confirmed cases. 65 of them were Somali children. 95% unvaccinated. 31% hospitalized. No one died. But 31% of 79 sick children required hospitalization in Minnesota in 2017 from a disease that a 50-year-old vaccine prevents. The harm is not historical. That is the thing people need to understand about this story. In April 2006, a 13-year-old boy in Britain died of measles, the first UK measles death in 14 years. In 2013, an epidemic moved through Swansea, Wales. 1,455 cases, 1 person dead. A 25-year-old man who developed measles pneumonia. In 2019, the World Health Organization reported 207,500 measles deaths globally, the highest count in years. The WHO listed vaccine hesitancy as one of the 10 greatest threats to global health that year. And then, February 2025, a 6-year-old girl named Kaye Fair died in a hospital in Lubbock, Texas. No underlying health conditions, not vaccinated. She was the first US measles death in a decade. An 8-year-old named Daisy Hildebrand died days later. Same outbreak, also unvaccinated, also no underlying conditions. The 2025 outbreak spread across 25 US states. 762 cases in Texas alone, 99 hospitalizations. The linked outbreak across the border in Chihuahua, Mexico, reached 3,872 cases and 13 deaths. Andrew Wakefield, at the time of those deaths, was living in Austin, Texas. His closest political ally, Robert F. Kennedy Jr., had just been confirmed as the United States Secretary of Health and Human Services. When a CDC webpage was quietly edited in late 2025 to remove the statement that vaccines do not cause autism, Wakefield called it vindication. He has never recanted anything. The MMR vaccine is 97% effective after 2 doses. It takes 15 minutes to administer. It has been available since 1971. The children in the 12-child study that started all of this are adults now. Most of them never knew their medical records had been altered. Some of their parents spent years fighting a case that was built on their children's falsified data. Wakefield received £435,643 for that study. He never gave it back. The science on MMR and autism has been settled for 2 decades. A Danish study tracking 657,000 children found no link. Their Cochrane review drew on data from over 1 million children. The autism rate ratio in vaccinated versus unvaccinated children was 0.93. Vaccinated children were marginally less likely to be diagnosed with autism. The fraud was identified. The paper was retracted. The doctor was struck off. And measles came back anyway, because a lie, once it finds the right audience, does not need the liar to keep telling it. If this story made you angry, or scared, or both, the next video is right there, and it will make you feel the same way.